Welcome to the first webinar of Rapid Physiocare. I thank each and everyone who have signed up. Really appreciate your time taken on this Saturday afternoon. My name is John, and I'm the Senior Principal Physiotherapist of Rapid Physiocare. So this webinar idea came because of this circuit breaker time when we were closed for a month, whereby our team of friends joined together with a discussion to come up with some educational values which can be shared to our clients, our friends, our family who have been constantly asking for questions with regards to physiotherapy and related injuries. So all these idea was compiled together with a team of experts within our company, and we came with a topic called the managing body aches and pains. So it's a very big topic, very generalized topic, whereby we need to talk a lot of things, but however, we have consolidated the points with regards to what we want to focus today, because we just want to make this time short. We want to make sure that what we say is relevant to the participants, and you should give us your feedback with regards to how we did it as well. So my name is John again. I'm the moderator, and with me, my co-moderator is Rahul. Rahul is a very trained physiotherapist who has been with Rapid Physiocare for a while. He's our clinical director. His main expertise is in sports and pain management. Rahul has a vast experience in pain management and dealing with a lot of patients with body aches and pains. And he has been working as a physiotherapist for 18 years, and mostly his time was spent in community hospital, in public healthcare system. And Rahul has done his trained in sports medicine and likes to treat patients with a holistic approach, not just managing their symptoms. Rahul has a passion in teaching as well, whereby he has taught a lot of students who are his mentees now. One thing good about Rahul is that he loves to explain the condition and also make sure that the patient understands the problem rather than just treating what the patient wants. And as usual, I'm John Abraham. As you all know, I'm a senior principal physiotherapist of Rapid Physiocare. And nothing much to say about myself, because I just love my work. I enjoy what I do. I love my patients, and being a physio is always my passion. Before I leave this place and hand over to Rahul, I would like to thank everybody for attending this webinar. I also want to excuse us if you see any fault or if any technical issues, because we just did it as a first time. So I hope you all will pardon us for that. And if you have any questions, questions with regards to the conditions you want to ask us, please be frank and open. We will try our best to answer to your questions. However, because of the limited time, we will try to answer the most suitable questions for today and relevant to the topic. However, we will email you with your concerns and the questions. That's all for now. I'll come back again after Rahul's talk. Thank you. So today's topic will be basically about managing body aches and pains, as I mentioned earlier. And mostly usually is because of we have seen an increased number of patients with body aches and pains after working from home due to COVID. So that is, as I mentioned earlier, that's one of the reasons why we put up this topic. And we are going to show you a short video with regards to our company. And before I again pass it to Rahul now.
Welcome to Rapid Physiocare. Rapid Physiocare is a prominent physiotherapy clinic in Singapore providing effective specialist physiotherapy service. Our therapists are all highly trained and qualified professionals with extensive experience in treating a multitude of conditions. We aim to improve the quality of lives of as many people as possible by empowering them and helping them realize their potential. For many years we have been delivering the best clinical service to our clients with excellent outcomes, which makes us the most trusted choice for physicians, families and health professionals. Rapid Physiocare clinics are strategically and conveniently located within the Central Business District, CBD, so help is always within your reach. Our team are composed of well-trained professionals having the skills to provide great customer service. Rapid Physiocare provides a wide coverage of services such as musculoskeletal conditions. Musculoskeletal physiotherapy is the term used for treating clients who suffers with disorders of the musculoskeletal system. Post-orthopedic conditioning. It is important to see a physiotherapist while you are waiting for an orthopedic surgery. Neurological conditions. Physiotherapy treatment for developmental delay, Parkinson's disease, spinal cord injury and for stroke patients. Home care rehab and caregiver training. There will be times when loved ones need to be cared for at home. We have expertise on shockwave therapy, ESWT. Extracorporeal radial shockwave therapy, ESWT, is a series of high-energy percussion delivered to an affected area. And we also provide basic gym equipment. We are also partnering to the world's leading healthcare insurances. You can follow and like us on Facebook, Twitter and Instagram. For more details you can also visit our website at rapidphysiocare.com. Thank you.
Hi, good afternoon, guys. I'm Rahul. Thanks, John, for giving a short talk before I have to start, and thanks for the introduction. Hope everybody is logged on and is really looking forward to this short talk that we are going to present to you guys on managing body aches and pains. So before I head ahead, I would like to tell the participants that we would be taking questions at the end of this talk. So what you could do is you could just type in your questions and we'll try to answer most of the questions in respect to the time, and we hope that it's really helpful for you guys. Okay. Okay, so managing aches and pains. Well, experiencing body aches and pains are normal, right? So, however, if these really last for long periods of time, we should not be ignoring them. And most of the times, lack of movement and sudden increase in activities could be a common cause for these body aches and pains. And the common conditions that we are seeing currently are the neck pain, shoulder pain, wrist pain, lower back pain, knee pain, and ankle pain. What we have seen in the couple of last weeks during the circuit breaker, these are the common conditions that we have seen our clients complain of. So we would be taking this opportunity really to handle these questions and having these topics to the best of our course and see how we can help you guys to improve your condition. Okay, let's start with our cervical region, probably the most important part of our spine. So let me get you through a little bit of the anatomy. Most of the curve that we see in our cervical spine actually occurs at the C1-2. So guys, you would be thinking, what is really C1-2? So cervical 1 and 2. So this is the most uppermost part in your cervical spine. And approximately 50% of the time, the movement that happens is happening at the occiput, which is at the highest level and at the first two levels in the spine. So there's a lot of movements that are happening in the upper cervical spine. As we also know that the spine is really very flexible, is really very resilient. And what I really feel that, the more we move, it's good for the spine. So, and also what we are also concerned about is the stability. So what really stabilizes the spine? So what we know that all the stability, or most of the stability at least, is provided by the muscle system that we hold across this cervical spine. So if this, as we grow, the spine may become stiff, but the muscles are still there to give it the strength, give it the flexibility, and give it the mobility. So we should remember that our musculoskeletal system can actually adapt to whatever the situation may be. Okay, so what are the common conditions that we feel we are actually having or people complaining of at this point in time? So the common conditions we are seeing currently is cervicogenic headache. So what's really cervicogenic headache? And you'll be surprised that one of the clients that presented to me with this condition recently. So cervicogenic headache is basically pain around the head, usually on one side of the head, but the pain actually is coming from the cervical spine. Most of the times this is coming from the upper cervical spine. And maybe I could just show you where usually most of the problems come from. So again, same thing. It's usually the upper cervical spine, the C1, the C2, and the C3. These are the usual culprits, and most of the times these areas get very stiff, painful, and this would sometimes cause pain around the head. Most of the times the pain is caused by movements in the spine. So you people will complain to us that, when I move my head, I get headaches, and as I don't move my head, and the pain kind of resolves, but it kind of persists for periods of time. And we physios are at the front line to handle these kind of headaches. Simple things. So this could be really, really one of the things that people complain to us recently. Then simple neck strains. Neck strains really, in simple terms, is strain to the neck muscles. Cervical spondylosis. So what does really cervical spondylosis mean? Basically, it is about the spine. As we get older, there are normal changes that happen in the spine. There is some wear and tear that happens. What does happen is you do see that within the cervical spine, there are small discs between the spine. And if you could see that, so in between the spine. So as we age, the space between the bones start to get lesser. And that's really, really normal. So people start complaining of aches and pains around the spine, and which then causes all the pains. Coming back again to what we call as a disc related pain. So as again, pain may come from a disc. What is really a disc? A disc is something that is between your cervical spine. So all the bones that you see in between this, they are small discs, and this could be a potential to a pain. Most of the times, as again we move, we keep seated for long periods of time, this could get pressurized, and that could actually present with pain. Coming down again, so what we could again be seeing in our clinics is cervical radiculopathy. Cervical radiculopathy really means that the nerves that come out through the spine, as you could see, small nerves that are coming out through those areas, these could get compressed. Most commonly, the reasons for compression could be pressure from the disc that we just talked about. This could cause pain going down the arms. At times, this is one of the reasons for the pain. Occasionally, the space between the two joints may get narrowed, and that could put pressure, causing pain, numbness, and tingling around the shoulders, around the arms as well. So this is the common complaints that we as physios are actually seeing in this recent circuit breaker period. So common causes that we have found out really in this times are that poor postures or sustained posture. So really, what does it mean? That what happens is when we are sitting for long periods of time in postures that may not be very comfortable, that could cause these aches and pains around the neck. Sometimes what we also see that the age-related changes, as we talked about in the cervical spondylosis, those could trigger pain, most probably also because of the poor postures that we may be sitting using our computers, occasionally using our laptops, so may not be sitting in the best posture. So that could also trigger pain in people who already have some spondylosis or wear and tear in the joints. That could trigger some kind of aches and pains. Finally, the other causes that we have seen, so nerve compression. One of the things that I really see commonly in all the conditions that discussed before, one of the things is the postures that could predispose to all these symptoms. So nerve compression really means that the nerves are getting compressed, and that could be causing the pain itself. So simple tips to manage your neck pain. Let's look at some simple tips, what we should be doing, how we can help ourselves to manage these symptoms that we are getting, probably because of sitting long times, over maybe a whole day. Sometimes it's about 3 to 4 hours. So important thing that we should be taking note is get a proper chair where you are seated really upright, your screen level is at your eye level, your arms are really well supported, and that would really take away the tension from your neck. And it's important that you should have a proper table that is well supported as well. It is not too low so that you have to keep looking down. So ideally, I would think proper ergonomics is really very important in these times where we probably have to work from home, where we may not have the best ergonomics to take note of. The other thing is very important that I would think for neck pains is get up and move often, which would be one of the things I would suggest. Even though you may have a very good dynamic workstation where you could get up and move often, I think that would really be helpful to get up and move. Ideally, I would suggest maybe about 25 to 30 minutes of getting up after you have seated, and then maybe getting up for about 5 minutes or so, getting back again and starting to work again. So that really will be helpful to ease off some of the neck aches and pains. Take small breaks to look away from the screen. Well, this is really helpful to lessen the strain on the eyes, because if we keep seated for long periods of time, the eyes start getting tired, and what we really want is a very quick look away from the screen for a few seconds, maybe about 20 seconds, look away from the screen, look back again. So that will recalibrate your eyes and then relax your eyes, which will again help you with not straining yourself. I would take this opportunity to really, at this point in time, since we have gone through some of the slides, to answer some of the queries. Yes, so I have Aaron, and at this point in time, he's actually asking us, he has a frozen right hip joint, and I can't bend forward to touch my toe. I cannot reach and wear my socks, I believe, and also I have lower back pain. How do I handle this situation? Hi, Aaron. Thanks for asking this question. We will discuss this in the next coming slides for the low back pain slides, but I think I'll just take this as an opportunity to answer a few questions. So yes, it is very common that at these periods of time, because if you're seated for long periods of time, your hips start getting very stiff, and moving as much as we can. So maybe moving after 30 minutes, that will be really helpful. And sometimes moving itself will ease off the pain. But I may suggest simple stretches, like, for example, just getting your knees as close to your body as possible, hugging the knees, and that should relieve a bit of pressure over your hip and the back. So that should help you to ease off the pain. I would also suggest that if this has been persisting for long periods of time, it could also point towards having some pathology in the hip. And if so, and it's been lingering on for long periods of times, I would suggest to maybe get yourself checked with a physio, and then maybe we can move on from there. But for now, I would think just stretching would be a good way of really helping you to ease off symptoms. And you'll be seeing some videos, you'll be seeing some stretches that you can try and see whether that helps you with the pain itself. Okay, let's move on now, guys. So let's talk about the shoulder. Well, shoulder is really a very mobile joint. There's a lot of movement. There's a lot of muscles going around the shoulder. One of the things that you commonly see around the shoulder is your shoulder blade. All right, so shoulder blade is almost like a very flat kind of a plate, and you see a lot of muscles around the shoulder. Important thing that you see is the shoulder has also a long bone, which we call as the humerus, and this is the scapula. A lot of attachments over here. You have your muscles that are attached at the back. This is the front part of it. This is the back part of it. So you have muscles that really help us to move, and this is very, very important for us to maintain mobility and flexibility in the muscles. Let's moving on. So what's this? So really, if you could see this this picture here, and what do we see? So actually what we see is your spine, cervical spine that we discussed just now, has a very, very close relationship to our shoulder, which really means that if anything happens to your shoulder, it has its influence on your neck muscle. So if you have neck pain, sometimes occasionally you might get pain around your shoulder as well, and vice versa. If you do have a shoulder problem, you might get problems in your neck. So both of them are really very closely related to each other. And hence, we as physios, when we do see shoulder problems, we do actually check your neck to rule out certain structures that may be causing pain in your shoulder. And as well as when we see your neck, most of the times we also look at your shoulder to rule out muscles, joints that may be affecting your neck or shoulder as well. Okay, so the common conditions that we see that during this period for the shoulder is frozen shoulder. This is really one of the common conditions we see. It clinically presents with a lot of stiffness around the shoulder joint. People will start telling you common complaints like, you know, the sudden movements of the shoulders are painful. People start getting pain more at night. The shoulder movements initially starts being painful, eventually to a phase where over months and weeks it starts getting stiffer, and then the pain starts getting lesser as the time goes by. So eventually a patient usually complains that, you know, my shoulder is stiff, I really can't move much. And we at physios would really help you guys to actually move the shoulders, get it moving, mobilize it, and it has a very good response for physiotherapy. Coming to the second one of the common conditions that we are seeing. So rotator cuff tendinopathy. So what's this really rotator cuff tendinopathy? Rotator cuff tendinopathy means the tendons that surround the joint are usually overloaded at times, and at times there is some wear and tear, and that pain usually comes from these tendons that get overloaded. So let me just show you an example. So basically the shoulder rotator cuff is these white tendons that are supporting your humerus bone. So these, again, same thing, it comes from the shoulder blade and then comes and attaches to the shoulder, which is your humerus. So it is closely related to the shoulder blade and the humerus. So I take this again opportunity over here. I have a question from one of my clients over here, and he was asking me, what's really this rotator cuff tendinopathy? So how, hopefully I have answered that it's tendinopathy, or in olden times we used to call it tendinitis. So what is tendinitis? So it is very similar to what I talked about tendinopathy. It is an overload to the tendons around the rotator cuff, and usually presents with pain that is surrounding the shoulder. It could go down to your arm as well, and people may find it very painful to start off with, but eventually with good treatment, some medications, usually modification of activities, you will get better. So there was a question that I should actually take at this point in time. So one of the patients did ask me, I have tendinitis in my left shoulder. What can I do about it? And this really causes me to have pain around in my neck as well. So as I was talking about it previously, neck and shoulder is really related. And this is a very good example where, you know, pain in the shoulder can actually cause distress to the neck as well. A very simple way of dealing with tendinopathy is, if it's in the acute phase where pain is really limiting you to movement, you could try some cold packs, you could try some heat packs to lessen the amount of pain, and that should most of the times ease off the pain symptoms. You could need some pain medications if the pain is really in the moderate to severe range. But really what is helpful for tendinopathy is doing exercises. So some form of strength training is really recommended. I would suggest a simple exercise to start off with. So just take a TheraBand if you have so. If not, if you do have like a towel with yourself, if you don't have like a TheraBand, then you could use a towel. So just getting your TheraBand to hold it across with your wrist, and then just simply opening this up and holding it, say, for about 10 seconds. Okay, So just hold it there for 10 seconds and then coming back again. And as you keep doing that, just hold it. We really don't want to move the shoulder at this point in time when it's very painful. You could start off with just stretching out the tendon, holding it there for say about 20 to 30 seconds or so, just holding it there. Start with 10 seconds, go on to 20 seconds, go on to 30 seconds eventually when you feel you could hold on to. I would recommend doing this exercise, say about 5 times at one time, and then doing it maybe over a period of time in a day, maybe 3 to 4 times to 5 times to a maximum. So holding this exercise for about 10 seconds, going on to holding the TheraBand to about 30 seconds, repeating it 5 times in one session and doing it 3 to 5 times in a day. So with this, usually you build up strength in the tendon. You will also feel that the pain will lessen down after doing this exercise. So that really will get you to move more and will get you to the path of recovery. I would also suggest that have patience with rotator cuff tendinopathy because it takes 6 to 8 weeks usually to get better. So what you will find that in this condition, most of the times the pain that is there, that starts to lessen. Your morning stiffness goes away. That would be probably the first sign that you will see. And as you keep doing the exercises regularly and really do more strength training, you will feel that your range comes back, your pain goes down, and your strength comes back as well. So hope I would have answered some of my clients' question about this common condition called as rotator cuff tendinopathy or tendonitis. So osteoarthritis of the shoulder. So osteoarthritis is really wear and tear of the shoulder. So as we discussed in the previous slide, cervical spondylosis is pretty much similar to that, and there is wear and tear in the shoulder joint. Most of the times when we deal with this condition, we help people gradually reduce pain through using hot packs, sometimes cold packs, and getting the shoulder to move. Very similar eventually to the rotator cuff, we will start to do some gradual strengthening exercises. So not necessarily if there is wear and tear, which means it's the end of the shoulder and you can't improve. There is good chance that even with early stages of osteoarthritis in the shoulder, you could actually improve your condition and quality of life by having exercise as one part of the therapy. As I discussed before, one of the common things that we are seeing for the shoulder pain as well is having awkward postures during this period of time. So again, this really comes across quite consistently for most of the conditions that we are seeing. However, one of the things that's very specific to shoulder is lifting heavy loads, which means lifting heavy loads could be very individual participants. So some people could say that I've been lifting 50 kgs, some people could say I've been lifting 2 kgs, but individually, so it depends of what you were doing before and what are you doing now. So we do see clients telling us that I was doing like previous to the circuit breaker, I was doing activities there were on a milder way, and then eventually when I had more time at home, I started lifting more weights, I started being more repetitive in my repetition, and that's where you will usually find that the increase of load actually triggers pain, and this could be one of the reasons why repetitive movements, doing it more repeatedly, lifting more weights, lifting heavier weights could predispose to a shoulder pain as well. And as discussed before, osteoarthritis could be one of the reasons for osteoarthritis could be the age-related features. And however, I would also want to educate you guys on this. Increased age, being older doesn't mean that you have to suffer. We can always work with patients and improve their quality of life, working with strength, working with flexibility, working with the muscles. And muscles are really very smart. They can actually adapt to the loads that we place in. So these conditions at an early stage, if diagnosed, it can still be helped with physio. Okay, let's move on to another area that we wanted to discuss, the wrist joint. Again, a really, really complex area that we see, not so much as compared to, I would say, neck and the shoulder. However, we do have clients who come in with wrist pains, and these are really very challenging at times because people keep ignoring these simple pains around the wrist, and they eventually turn out to become quite chronic in nature. So simply wrist, what is wrist actually? One of the things that we see around on your picture is these small carpal bones, and usually these really hold our wrist together. So you have these 8 carpal bones, that is, you could see them on your screen, and usually they are held together by your long bones, which is your radius and ulna. And most commonly what you do see, you see pain around the wrist, as you see in the picture. So you will commonly see people complaining of pain on the inner part of the wrist. So this is really very common. Common conditions of the wrist, very similar to how we discussed for the neck and shoulder. So common ways of looking at it is getting wrist sprains. This is something that we see occasionally because of maybe lifting something and twisting your wrist, lifting something in a very awkward position. The second very common thing that we see is tenosynovitis. In simple terms, it means inflammation of the tendons. So these tendons are basically, they are muscles, but eventually these become thin um, uh, wire kind of things, and they usually get inflamed most of the times because of repeated movements. So we do have a lot of tendons around the wrist and around the thumb. So most of the times, a lot of people will complain of pain around the thumb area, and this is commonly we do see people using a lot of computers. The third, but not the last condition that we see a lot of times is this carpal tunnel syndrome. So carpal tunnel syndrome, what is really carpal tunnel syndrome? Carpal tunnel syndrome is like a nerve that gets compressed in your wrist. Most commonly, the area that we find that is the issue is around the wrist, where it joins our hand, the palm. There is a nerve that runs through here, and we call it the median nerve, and that usually gets compressed. Most of the time is again because of many reasons, but one of the things that we do see is because of improper postures. The area gets very swollen, and then that creates pain and tingling sensation. So your pain and tingling sensation can really go through your index finger, your middle finger, and at times the finger just besides the little finger. So you will complain of pain and tingling feeling. Most of the times this pain would be quite severe to start off with, and you will complain of pain at night more. And this then really needs some attention to it. And physios are really capable to help you with this condition. And important thing is to really diagnose it early and find out what is one of the major causes for all these symptoms, and then treat it from there. So what are the risk factors to these common conditions? So as we discussed before, posture really comes up very common between most of the conditions that we are seeing. So as you see on the screen, poor wrist position. So your wrist not resting over a soft, probably padded area, resting on corners, being there for long periods of time, that could really predispose to common wrist pains that you might be feeling. Repetitive movements, using computers, actually using a keyboard for long periods of time, typing very hard, that would trigger all these symptoms. So these could be the common risk factors that I would think that are commonly presented to us. And let's see if we could actually look at some simple tips to manage these kind of conditions around the wrist. So if you could see, a lot of times the wrists, if they are placed in very extreme movements, that would be a really no for wrist problems. So ideally, whether it's this position or going on and having extreme wrist positions in this way, would stretch and compress areas around the wrist. And also holding on the wrist in this position where you have no support, this could also predispose to injuries around your wrist and fingers. So ideally, what I would suggest is uh, the wrist position should be neutral. So it should stay straight ahead and be supported at the wrist level, so that it doesn't get those repetitive injuries around the wrist. Using the mouse, very similar things as well. We shouldn't be resting in a position where there is extreme movement of the wrist, whether it's your wrist is extended in this way, upwards, or in this way while using the mouse. So you should be resting it in a very neutral position so that your fingers and your wrist is really rested at all points in time. And I can tell you that we can always do this in a normal position, but I will tell you that this is not possible for a long period of time. So we should actually take break while we are using the computer, using the keyboard, using the mouse, and that usually will help you with reducing the tension on your fingers. Okay, let me tell you some simple tips or for exercises. And what we would want to start off with, right? So is really uh, I'll give you an example. Maybe if I have pain on my wrist, okay, and if I move it, I start getting pain around the wrist, but it is hindering me from movement. So what could be a way of reducing stress over this area? I could think moving my elbow first. So sometimes just moving an area which is above or before the joint would reduce the stress over the painful area, and that would create an opportunity for us to start moving our wrist. So this is one of the things, a simple tip that I would suggest for you guys to use it. If a certain area feels pain, you can start moving an area very adjacent to it. And another example would be if I do get pain around in the shoulder, I may start want to move my neck first and then move the painful area. Most of the times, because we do know the relationship between the neck and the shoulder, that should help you to ease off some pain. Another example, alternative way of movement. What does this really mean? You could see the picture where the physio is really hugging her knees. So a lot of times people will tell you and do complain of, and this is really one of the questions that we have got here, that I have low back pain, and bending and touching my toes is really very hard. I would suggest a very simple way of dealing with this to start off with is just lying down, keeping your back comfortable, just hugging your knees. This is very similar to actually bending down. So before really bending down and practicing that movement, maybe is a good way of just hugging your knees. So that would reduce stress over your back and the hip. Maybe that then will help you with your back pain. Another way of progressing this would be, if you feel pain when you are standing and bending, I would suggest maybe you would want to start with sitting and bending. So there's another way, really an alternative way of using movement to really help you with your pains. Okay, let me go through with you guys some simple neck stretches. Okay, so let's see. One of the physios demonstrating some simple neck stretches. This is a common stretch, what we call as stretching your upper trapezius, where our physio is demonstrating just going through some simple movements. What I would suggest is just holding on to your head on one side and then just gently twisting your neck to the other side. What am I stretching? I'm really stretching this muscle over on my right side. As I go and do that, I would want to hold it for about 10 seconds or so, and then I have to let it go. So that would ease off some tension and pain around the neck. So just one more time. And there we go. Hold it for 10 seconds, and there we go, back again. Another modification that we want to try, sometimes some people will tell you that there is pain around here, and sometimes the pain may be around the back of the neck. So this second stretch is really for pain that is at the back of the neck, where what we want to do is we want to just rotate our neck to the opposite side. We want to look down towards our armpit. Use the hand to really pull gently down, face down towards your armpit, hold it down there, and you should be feeling a good, nice stretch at the back of your neck. Hold it for about 10 seconds first, and then let go. Always remember, as you do your stretches, do it very gently. We do not want to force it lower down like this, because that may result in pain. So most of the times when you do your stretch, you should feel like a gentle stretch. You should not be feeling pain. So that is one of the key things that we look at when we are doing stretches. Okay, very simple exercises that you feel that you could do it when you are really working at your desk. You don't have to get up and move around. simple ways of just moving your neck. So let's do this. And if you guys are there, just start doing it, and that will really ease off a little bit of tension that you might be feeling while doing this exercise. Okay, so I would suggest first of all to start looking up. So what I would suggest is, as you start looking up, use your eyes to follow your head. So just move your eyes going up, slowly all the way up, and ease off. At all times, move very slowly, and then slowly come back down again. Nice. Okay, so we'll do it again. So just slowly move your eyes together with your head and just go all the way up as much as you can, and then bring it down again. Very good. Okay, so I would suggest doing these exercises over 5 to 10 repetitions, which will help to ease off the symptoms that you may get at the back of the head. Same thing, we did a stretch towards the top. We want to stretch the muscles towards down as well. So gently just roll your head down, focus on your eyes, eyes moving with your head. So look down, hold it down for a few seconds. You could count 1, 2, 3, 4, 5. Great. And then come back up again. Nice. Okay, remember, this should really feel like a stretch, should not feel like pain. Okay, so if you do feel pain, you should stop at that point. Okay, so let's do it again. Slowly move your head down, follow that with your eyes, look down, and then slowly come up. Okay, that's good. So let's go around with the next stretch. Slowly start turning towards your right side and back again. Nice. Use your eyes with this neck stretch. It really helps to coordinate your muscles. So this is one of the tips that I would suggest when you're doing exercise. So just move your neck and turn, move it slowly with your eyes moving along with your neck. So let's do that again. So let's gently just turn to the right side. Nice. And then come back. And then repeat this for about 10 repetitions. That will be helpful. Let's move on to the left side. So let's move it to the left. Nice. And come back. Okay. Again, so move your eyes along with your neck movement. It's always feeling a stretch. As we move towards the left side, you should be feeling a bit of stretch on your right side as we do this. Okay. Now, moving on the next stretches, gently tilt your head to your right shoulder. Remember, one of the things that we commonly see while doing the stretch is people tend to bring their shoulders up. So you wouldn't want to do that. So gently just stretch without elevating your shoulders. So keep your shoulders relaxed. If you do feel pain, just stop at the limit where you start feeling pain and then gently come back. That should be helpful. Okay, so let's go down slowly to the right and come back. Very good. Let's do it on the opposite side. And bring your ears to the left shoulder. Remember, not lifting your shoulders up. Okay, keeping your shoulders nice and relaxed, and then bringing it up again. Good. Let's do that again one more time. Bringing your head towards left shoulder. Nice. As I said, always be gentle with your stretches. Hold each stretch for about 10 seconds. You could repeat these 5 times, and over in a day, you could do this 2 to 3 times. And remember, if you do feel pain, stop when it starts to get painful. Okay, some shoulder stretches. So one of the common things that we do see around shoulders when we are sitting, a lot of times we are sitting with our postures being very slouched in front of the computers for long periods of time. So that then causes pain around the neck, sometimes pain around the front part of the chest, around your shoulders. A very good way of really opening yourself up is just going to the corner of a wall, just being there and then just bringing your chest forward, and that then helps you with the stretch. And come back. Okay, so count 1, 2, 3, 4, and then you hold it, and then come back again. Nice. Okay, so as we keep moving, important is to still count it rather than just being too aggressive with the stretch. I would suggest slowly just get on with the stretch. So just start counting, find a corner of a wall, put your hands over the corner well supported, and then just start stretching. Nice, and then come back. Okay, so let's do this. 1, 2, 3, 4, 5, and there you go. So stretch. Nice. Okay, let's move on to the next stretch. But this is one of the stretches that we feel helps with people complaining of pain at the back of the shoulder. So if you have pain that is usually at the back, maybe around your shoulder blade, this is a nice stretch that would help ease off with pain around the back of the shoulder. So arms, right arm supported on your left shoulder, and gently just pull over the elbow towards your left shoulder. So what ideally you should feel is a good stretch at the back of the shoulder. Hold it there for 10 seconds and then bring it back again. So let's count. So let's go 1, 2, 3, 4, 5, and hold it there. Hold, 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 hold. Nice, good, very good. Okay, let go. Okay, let's do it one more time. So move your hand across your left shoulder, hold it there, hold and push with your left wrist and feel the stretch at the back of the shoulder. So again, it should be a stretch, not pain, and come back down again. So this is one of the common stretches that we do see teach our clients, and I have found it to be very helpful with people complaining of shoulder pain. Now, the next stretch that we are doing, or we could see on the picture, is something similar to the first stretch, but if you have problems on one side, you could get your arm at the corner of the wall and then gently just stretch forward. Remember, the stretch has to be felt in the front of the shoulder, around your chest muscles. It shouldn't be a pain that comes over at the top of the shoulder or at the back. So what ideally you should be feeling is a bit of stretch in the front and not at the back, or any pain at the top of the shoulder. So there should be a gentle stretch over the front. So similar way, we hold it for 10 seconds and we repeat it 5 times. And this could be really done over 2 to 3 times in a day. Coming back to wrist and finger stretches, something that I feel everybody should be doing if you are on your computers and laptops over a long period of time. A very simple way of stretching your neck or your wrist is bringing your palms down towards the floor and then adding a bit of gentle pressure with your other hand. What you should really feel is a stretch coming along at the top of the wrist. Hold it there. So hold it for 10 seconds and then let go. Ideally, if you are doing this stretch, you should do it with your arms straight and outstretched. Try not locking your elbows, so keep your elbows relaxed and just stretch it gently. So bring your palms down and then add a bit of gentle overpressure with the other hand and hold it there for 10 seconds. Nice. And then you let go. Okay, so repeat it 3 to 5 times. And come back again. In a similar way, now facing your palm upwards, using the other hand to give a gentle stretch. Hold it for 10 seconds as well. What you should be feeling is a good amount of stretch below on the forearm. So what we did before was for the forearm on the top, and now what you should be feeling is a stretch just below over here. So just gently stretch it, hold it there for 10 seconds with a gentle overpressure with your other hand, and then let go. Go again. pull, hold it there for about 10 seconds, and then come back again. Okay. Okay. So simple movements really help with this aches and pains around the wrist. Let's then move on to a bit of stretches for your fingers. Fingers as well need some amount of stretches, I believe, because you are gripping a lot of things during the daytime. You're going on typing, you're carrying stuff. So simple exercises to move around. If you don't follow these simple and find it very difficult to do, you could just move your wrist. But let's start off with some simple stretches for the fingers. So keep your wrist and fingers in straight line. What do I want to do is start bending your fingers until you can see the knuckles facing upwards. So your knuckles facing upwards. Okay. And then moving on, bending at the knuckle joint gradually. And we'll just open up. Okay, so we'll just repeat this step and we'll move on to the next stretch after that. So let's start off with just this position first. Let's keep our fingers, wrist in nice and steady position. A lot of times people tend to keep their wrist very, very extended. I would suggest keep it nice and relaxed. Just keep it nice and straight. You don't have to hyperextend or extend it too much. So start off with fingers, wrist in nice, relaxed position, straight ahead. Slowly bend down until you can see the knuckles facing upwards. Okay, and then moving on, flexing your wrist more, and then gradually bringing it up again. So that's something that you could start doing. What you should really feel is no pain again, but what I would suggest is doing it slowly. There may be some discomfort, which should most of the times be a pulling sensation around on this part of the hand, and that should be pretty normal. And as you keep doing it, it should get better. So let's move on the next stage of the stretch. Again, position your arms, the wrist and fingers in straight line. Bring your fingers in what we call as a tabletop position. So you are really in a very horizontal position to the floor. From there, almost make like a fist so that your fingers are resting on your palm. Okay, and there you go. So go back again to that same position and then bring your fingers down again to the palm. Again, what you should be feeling a little bit of tension around the hand and the wrist, a little bit of tension around in the palm, but that's pretty much normal. And this is part of just moving and stretching slowly. Okay, let's do that again one last time. So get into a tabletop position, bend your wrist, and come back again. Okay, hope you guys enjoyed the simple stretches. Remember that if you do have symptoms and they persist for long periods of time, I would suggest that you should seek professional help. Guys, let's go for a short break and you'll be soon joined by John for the next session.
Hi guys, so I'm back again. Um, so one of my favorite topics, which I always love to treat, is low back pain, because there are a lot of myths and misunderstandings which patients always have with regards to low back pain. I have seen 30 years old coming down to me saying, "Oh my God, John, I had a low back pain 3 years ago, and my doctor said that you can't move. Can I go back to sports? Can I go back to any kind of activities? I have small children at home. Am I able to lift them up or not?" So I always say that it's all these are myths, and always all depends upon the severity of the pain. So I always say that don't take any pain lightly. Don't try to self-medicate. Always seek medical opinion. Again, as I want to reiterate again, whatever advices we say here, whatever talks we give over here, just take it. And if you have any doubts, please do write into us rather than just self-medicating yourself. So again, when it comes to low back pain, there are three general types of low back pain. There are mechanical low back pain. There are different like non-mechanical and also referred mechanic pain. So I will be touching basically on mechanical low back pain, which includes non-specific musculoskeletal strains. Like for example, today morning, 8 o'clock, I saw a patient. He came to me saying that, John, I sneezed yesterday night and I suddenly got a pain on my back. How can that happen? And he came with a listing posture whereby his posture is slanted to a side, and we are always he was catastrophizing about it, worried that whether he can go back to any kind of sports and all those. So in this picture you can see that there is a nerve which passes through the low back, which is called the sciatic nerve. There are different nerves which pass through the lumbar area, the low back. Like for example, this is the low back, so this is a disc like what Rahul has specified, and you can see nerves coming through it. So what happens is, from the lumbar area, when that nerve impinges in between the disc, that is when sometimes people usually complain of shooting and radiating pain over the legs. And when that comes in, what happens is patients get a lot of pain and they can't move. And there are also other kinds of degenerative disc issues usually I've seen with bodybuilders or weightlifters. Because of a lot of bending and lifting of their body, they usually have a lot of degenerative changes in their disc. And another scenario whereby I saw I think 45 years old gentleman who came back and said that, oh, I did an MRI and I'm just 45 years old and it shows degenerative changes. So degeneration happens along the time, and also degeneration also depends on the amount of work you do, and also depends on your occupation. So nothing much to worry about it, unless there is any specific pathology whereby there is any infection, or if there is any referred pain which comes usually because of the kidney issues or any other aneurysms or internal organ issues. That is only the time you need to go for a specialist opinion to find how things go in. So I want to show you a simple exercise video where we are going to show you some exercise for low back pain. The reason is because I won't be able to demonstrate low back pain exercises. So we will be showing you the video shortly.
Singing, take me home tonight. I need you in my arms to wake up and feel alive. Sweet Arizona, yeah, I just can't get enough. I just can't get enough, no, I just can't get enough of you. Sweet Arizona, sweet Arizona. Her hair was fire red like red rocks in the sun. Her eyes were stained glass like blue under the glacier runs. Nowhere we're going, still don't know where she came from. La la la, la la la, la la la. Singing, take me home tonight. I need you in my arms to wake up and feel alive. Sweet Arizona, yeah, I just can't get enough. I just can't get enough, no, I just can't get enough of you. Sweet Arizona.
Whatever exercises has been demonstrated over here, you have to ensure that you get sufficient stretch. You ensure that you hold for each exercise, you hold for 10 to 15 seconds so that you get the stretch properly. And ensure another thing with regards to low back pain is that whenever you're going to bend down to pick something, you ensure that you bend your knees and then go down to pick up any object. So this is with regards to the back. So next common case I usually see in my clinic is with regards to heel pain and ankle injuries. So ankle is a very complex joint with multiple structures in it. I wouldn't go much in detail to that, but however, I will go with regards to heel pain, which is called plantar fasciitis. And another similar condition, what we see usually is called tendo-Achilles ankylopathy. The reason the tendo-Achilles tendinopathy, which what happens is mostly happens when there is a inflammation of the tendon. So here you can see in this slide, it usually happens to people who stands a lot, runs a lot. So during this COVID breaker time, most of the people were exercising a lot at home. And recently we could see a lot of patients coming in and telling us that, oh, John, nowadays I have sharp pain over the base of the heel. So when I used to be, the base of the heel is over here. And what happens is patients usually complains of pain pain usually comes in the morning time. That means when they wake up in the morning, when they come out of the bed, when they put the foot first thing on the floor, they get the pain very, very severe. And then that pain slowly eases off when they do a bit of stretching. So you can see over here the plantar fascia. So in the picture, you can see that the plantar fascia is the fascia which is underneath the heel, whereby it gets inflamed, and that causes a lot of pain for the patients. And then about the Achilles tendinopathy usually happens to patients, you can see at the behind the ankle, which is at the behind. So there is a calf muscle up on top, and it comes down and inserts as a tendo Achilles. And that particular part becomes also very tight and inflamed, which causes a lot of pain and inflammation for patients. So for this, I'm going to show you another kind of video, which my colleague Olivia will be demonstrating. Uh, please watch it. Yeah.
Singing, take me home tonight. I need you in my arms to wake up and feel alive. Sweet Arizona, yeah, I just can't get enough. I just can't get enough, no, I just can't get enough of you. Sweet Arizona, sweet Arizona.
What happens here is usually for all these heel and ankle exercises, we always encourage the patient to hold for 10 seconds and also do a little bit of stretching as much as you can. For heel pain, another simple exercise is what we advise for patients are using a tennis ball or a tennis ball or golf ball, and you can use that, put it under the heel and try to roll as much as you can. If you can roll, you can slowly loosen up the plantar area, and this will also ease out the pain. So other common cases what we see are knee pain. So this is very commonly we see is usually is patellofemoral joint pain or runner's knee. The reason why I have chosen these kind of topics are because recently, as I told you earlier, we have seen an influx of patients with knee pain as well. So here I will be touching more about the patellofemoral joint, which you can see the patella, which is the kneecap, and also the femur, which is behind that. So there will be pain behind the kneecap. That kneecap which is under the knee, usually the pain will be exactly below this. So what happens is when patients run, patients move, they keep rubbing. So when there is a rub, the pain increases. So this is very common. This can happen usually for patients who run, patients who do a lot of climbing and cycling as well. So pain between the kneecap and the femur usually occurs due to overuse and trauma and due to increased training. So the next one is called the meniscal injury. Meniscus is like a cushion in between the knee joint. And this is again plays like a shock absorber. So usually a meniscal injury occurs because there is a trauma caused by a forceful twisting. Like for example, I just saw a patient last week. She was at home and working from home, and then when her child cried, she just came out of the bed suddenly, and that twisted that knee. So what happened was she came to us with a severe swelling and redness, and she was a bit worried whether there was a severe tear or anything. So these forceful actions can sometimes cause a lot of meniscal injury and also pain. Some patients, after the injury, they complain a little bit of locking. That means when they walk, they're unable to give a full flexion movement, and they feel that the pain has increased. And if you don't take proper care of this, this can lead to a complete tear. And when it tears completely, then you have to go and see a orthopedic doctor for further investigations. The other kind of exercises, the other kind of conditions, what I usually see is the IT band syndrome or iliotibial band. So commonly patients feel that, oh, I have pain at the hip, oh, I have pain on the side of the joint, the knee joint. So this particular IT band or the iliotibial band, if you look into the picture, it crosses from the side of the hip all the way to the knee joint. And this is a long elastic band which tightens up when you run. So what happens is usually when too much of exertion, too much of running, too much of climbing, all these kind of excessive activities can cause a lot of tightness. And because of this tightness, patients usually complain of a lot of pain. So what happens when they come to us? You know, when they come to us, we do a lot of stretching, we do a lot of hands-on therapy to loosen up the tension over the knees or over the side of the thigh. We make them use a lot of rollers so that they can slowly loosen up the tension so that the pain can slowly ease off. So these are all minor kind of stuff which patients usually encounter, but I always tell them that don't have to worry about the thing. The biggest problem what patients usually are concerned are the worrying factor. So what happens is they go and Google, they go and YouTube, they try to do self exercises, self medicate themselves, and thinks that things are getting better, but at the end it becomes worse. So how can physiotherapy help? So how can physiotherapy help is usually we have traction. Traction is always given for patients with low back pain, especially with herniated disc, or if the patient has severe low back pain and radiating pain coming towards the leg. So we use this machine is called the traction. We use shockwave. Shockwave therapy is very prominent and very useful for patients with heel pain, that is plantar fasciitis, and also for patients who have severe tightness of scar tissue or any tightness of the muscle and fascia. We use a lot of manual therapy for neck and back pain to loosen up the tension over the back and neck. Another thing is we emphasize a lot of core strengthening with clinical Pilates. So that's my colleague Sharon, and she teaches a lot of our patients for core strengthening with clinical and mat Pilates. Last but not least, we always emphasize on patient education, just to let it know a little bit on that, because for us, our clinicians always emphasize a lot of educating the patients, because patients come down with a lot of worries and also seeing a lot of doctors, seen from clinician to clinician, therapist to therapist, and they come out with a big concern thinking that the life has come to a stop just because of a back pain or knee pain. So we always emphasize to them that, make them understand the condition, give them the pros and cons of what they have to do, the do's and don'ts, and also how to emphasize a lot on ergonomics and how to manage their own aches and pains. So what do you think about your posture? So everybody comes to us and asks, John, I think I have pain because of posture. So this is the key word nowadays, posture. So everybody has, they go and Google, some says, oh, John, sitting 90 degrees is helpful. Sitting in at 45 degrees is helpful, 180 degrees is helpful. So again, I always don't emphasize too much about that, and I always believe how patients, each body reacts in a different way. So you can see, usually when you usually I have seen a lot of people when they work, they come to the end of the chair and then they have a lot of slouching posture. So this should be the way whereby when you're sitting, you need to make sure that your back is supported at the backrest. Remember, whatever happens, now is a very stressful time. COVID is happening, a lot of things happening. But remember, one thing is sufficient rest and good sleep is all important for joint health. Overdoing and lack of recovery is a form of stress to the body. Again, I want to emphasize again that for the past 2 months, we have been seeing a lot of patients coming back to us saying that they have been working, I would say, more than 14 hours because now they're working from home. Bosses call. I'm sure there must be bosses, there must be employees looking and hearing us. There have been situations whereby 6 o'clock the boss will say that, okay, let's go on a call. So what happens? These creates a lot of stress within them. This creates a lot of tension over the body, and then this also tightens up the whole structure. So the summary of today's talk was that, we have to ensure that we have to avoid postures where you need to maintain sustained positions, avoid extreme positions of the body parts and joint. That means like lying down in a very awkward position. I've seen patients who came down and said to me, John, I actually love to slouch back on my back resting on the bed and work on my computer. Some says that I sit on top of the table and work. I don't know how can that happen. So it doesn't. If your body will definitely respond to you when there is pain. So you should understand that when there is a slight discomfort, that means your next, if you don't take care, it's going to be painful at the next. So always ensure that proper posture and proper sitting you have to maintain. Always keep an open mind. We're always here to help you, to ask us any questions or anything like that. So next is question and answers, and I hope the session was helpful. And Rahul and we are going to answer some questions which our patients have asked us live. So the first question, like I said, I had a patient who asked me, John, when I have a low back pain, am I able to lie flat on the floor, or should I lie on a bed? So I always tell them that you can lie on any flat surface, because when you lie on a flat surface, you tend to get a little bit of traction over the back. But again, I wouldn't encourage a person who is having severe back pain to go down to the floor and lie down, because once that total action for him to go down and come up can cause a lot of stress over the back. So that particular thing, the patient has to be careful about when they go down on it. But lying flat on the floor is fine. But we have to ensure that they don't overdo it by going up and down. Somebody asked me, is memory foam chair, seat cushion beneficial for lumbar support and to have good posture? During on the past 20 years, I've never advocated for pillows or any kind of brands. So I always say that ensure that you have a proper ergonomic chair. The proper ergonomic chair is very important so that your back is supported. And if you don't have a proper ergonomic chair, you can definitely use a pillow or a lumbar support to make sure that the curve is properly supported. Having said, with regards to pillows, I usually don't recommend pillows, because I want to tell you a simple story. 3 years ago, I met a patient who came to me with neck pain. And then after neck pain, he said that, John, the neck pain has gone and everything is fine. And I just discharged him. He came back to me 6 months later with a severe neck pain. So this time what he said was, John, pain was fine, but this time I went to the US to travel, the pain came back. So I said, how come? Just because I didn't take my pillow, I think that the pain came back. So some people are totally dependent on certain things. So what happens is when they're dependent on this pillow or bed, and if you don't take this particular item when they're traveling, they seems to thinking that the pain is going to come back. So usually I would always be very practical by saying that, you have to ensure that don't rely too much on all these things, rather to be practical. You can have normal pillow and that should be okay. So the question is, I have severe low back pain, and when I sneeze, the pain increases. Yes. So yes, the pain increases is because you should understand that the low back pain is because of spasm. Spasm is because the low back is supported by thick muscles. which is supported from the spine all the way to your hip bone. So that's from here, this is the hip bone, and from here all the way up, the muscles are tightened up. So unless these muscles are loosened, whenever any movement, any kind of coughing or sneezing will definitely increase the pain. So what happens is when that increases, the pain becomes more. So we always emphasize patients to either go and see a physio or try to do some stretches to slowly ease out the tension over the spine so that slowly the pain decreases. So Rahul is here as well. So Rahul will be joining me to answer a few questions. We are going to cut down to 2 more questions because we have a lot of questions. So with Rahul's 2 more questions, we will be closing up this session today.
Okay. So
Thanks,
I
Rahul.
had this, yes, thanks, John. I had this very interesting question that was talking about pulley systems in our wrists, in our fingers. So let me just try to answer this question. And the question was, have I actually injured my wrist, and specifically to what we call as a A3 or a A4 pulley system. So for just for the participants, I've just marked these A3 and A4, A5 pulleys. So what really is this pulley? These are basically ligaments, and they support our muscles that run along our fingers. So if you can see very clearly, this is like A5. So this is the tip of the finger, and this is A4, this is A3 and A5, so on and so forth. So as it goes down, so what we see is this is, okay, so if people can see this is A5, 4, 3, and it goes down along. So there was a question that said that have I actually injured my A4 ligament? So my suggestion to this is probably go and palpate this area. So A4, so it should be just at the middle over here, and that if there is tenderness around this structure, there is swelling and bruising, most likely you have actually injured the pulley system in your finger. This is very common in climbers who like to climb, or people who like to hang. So this it could be something that you may have to take note of. Commonly, what we want to do with this injury is we want to immobilize it for at least 2 weeks. So that is when the tendons and the ligament starts healing. I would suggest that not doing any contact sports, or not even doing any climbing initially for 6 to 8 weeks, and then take it very slowly, following on. If you do feel that you are ready, your finger movements are normal, your swelling has subsided, you could go ahead and start doing some form of hanging and climbing, but take it always slow. I would suggest keep going from 8 weeks to about 3 months to take your course of rehab. However, if you do feel that the swelling and pain is persistent, I would still suggest you see a physio to rule out any further damage to this pulley system. So essentially, yes, if there is pain around and swelling around this area of the middle finger, very likely you have a pulley in your finger. So that's my answer to whether I have injured my finger. The second question I would like to take is this question put forward. This gentleman has been having pain for many years. He's a 72-year-old gentleman. He has done a surgery for his spine, L4, L5, and S1 in 2017 with insertion of implants. He says that he's been developing over a period of prickling sensation and numbness in the left foot and hip portion. And over a period of time, this sensation is actually getting worse day by day. I have no further information whether there is a bladder bowel involvement with this condition. So I would suggest that since this condition is not stable and it shows signs of getting worse, he should get it checked before we can do any intervention. So if he has not done scans for over a period of time, I would suggest to go and see a doctor whether this condition is really worsening. Is there a false alarm? Before starting to do any exercises, I would predict purely for the reason because the symptoms are getting worse. So you would want to look at the condition and then take it from there. The reason behind is purely having a history of having surgery done before and the age. So these two factors tell me that I would want a little bit more thorough examination before prescribing any exercises or any suggestion. However, if you are still having some discomfort, no harm doing heat packs and cold packs around the area of discomfort. Make sure that you do have sensation around the area where you have discomfort. So you could start with just checking with your hands and seeing whether you have similar sensation, and then moving on and doing some heat or cold packs to ease off the sensation. Yeah, that's how I would take this.
Anything else, Rahul?
Do we have time? Any more time, or we are done?
So there is a question this is the last question and answer. We are going to do it today. How do you differentiate shoulder calcific tendinitis and frozen shoulder, Rahul?
Okay, so usually frozen shoulder typically presents with pain that is gradually starts to get it gets increased in the initial periods of time, and then over a period of time the pain gets lesser. However, the movement starts becoming more restricted. So this is very typical of a frozen shoulder, where the pain initially is quite severe, and then the pain goes off over a few weeks to months, and eventually your shoulder movement starts getting restricted. And most of the time, this pain starts this starts self-resolution process over a period of time with physio, whether sometimes just doing self stretches, the pain usually improves. However, if I do rightly, it's calcific tendinitis, I believe.
Yeah, the difference between shoulder calcification, tendon calcification, and frozen shoulder.
Yeah, so calcification of a tendon is probably due to deposits of calcification of the tendon, and most of the times then you might need to actually ascertain the cause of it, the reasons for having a calcific tendinitis, whether there is a metabolic cause to it, whether this is really an injury in the past, and then you might want to get yourself treated by a doctor to just get it checked first, and eventually this calcific tendinitis then starts to get less pain, and we start to mobilize it when the pain is much under control.
Okay, just to add on with Rahul.
And then yes, yeah. So I would usually say one of the pointers to that, without even scanning or looking at it, is typically in a frozen shoulder, the pain is increasing and it starts reducing over a period of time, whereas in calcific tendinitis, it may not hold so the pain may persist for long periods of time, when you may not have a resolution phase. Yeah.
Okay, just to add on as well, with regards to the frozen shoulder, usually typical frozen shoulder patients, they have nocturnal pain as well. So at night, they will complain of, pain in the shoulder, they can't sleep. And at night, usually the pain increases. And also for frozen shoulder, they can't bring the hand behind the back. So like how Rahul mentioned, the stiffness will slowly regress. And then what happens is, and at this particular time, patient usually can't bring the shoulder behind the back, and that is when they find it very, very, very difficult. And also, if there is any diabetes, any other chronic diseases as well, that is also sometimes contribute to the healing as well. So again, frozen shoulder for treatment wise, I would say one of the challenging patients, I encounter with, patients who have with frozen shoulders because of the pain. Usually when we do physio, we do a lot of mobilization for the shoulder. So there's a lot of pain involved in that. So that is the only factor I find myself challenging when I treat patients with frozen shoulder. Other than that, it's a process whereby patient had to be very, very patient. Patients has to be patient so that the recovery will be slow but steady, and then gradually they will feel themselves better. So, so I'm just winding up this first session we did. Thank you so much, everybody, and I really appreciate the number of participants we had today. Really appreciate the time you have taken, and really, really thankful the amount of support we have, almost 100 over people who have joined us. And for more information, please look into us or email to us. We'll be sending out a survey form for you all to answer, especially the things which we can improve. And next time we won't drag the topic so long, we will rather please make it so that the patients can, the client, people who are listening to us can understand on that particular topic. Once again, really appreciate your time. Thank you so much.
Thanks a lot. Thanks a lot.